Thanks everybody for joining. My name is Mitch Stripling. I'm the director of the New York City Preparedness and Recovery Institute. For those of you who have been following our progress for a while, until recently, we were the Pandemic Response Institute, but looking at the state of the world in New York City and our commitments to health and health equity and preparedness, we thought it was better to adopt a new name that showcased our commitments to helping New York City prepare and recover to a broad range of public health threats. And today's event is really indicative of that approach. And that's why we're so excited to kick off our partnership with the New York City Department of Health and Mental Hygiene and their year of climate change with a series of events that are conversations about the intersections of public health and climate, the threats and opportunities that that intersection creates. So thank you all for joining us today. I'm so excited about this. We have two great speakers who are going to both educate you and be in conversation with you over the next hour and change. First, I'm excited to introduce Jeff Shaman. There's really nobody better to kick off this conversation. Jeff is a professor both at the Columbia University Mailman School of Public Health, as well as a professor and a vice dean at the Climate School. He's worked for many years at the intersection of climate and infectious disease during COVID-19. He was one of the nation's and the world's top sort of modelers and forecasters of that disease. And he's also been instrumental at looking at the impacts of climate on public health. He's going to start us off in a few minutes, and he's going to be joined by Julian Watkins, who's another one of my favorite leaders here in New York, who's the Assistant Commissioner of the Bureau of Health Equity Capacity Building at the New York City Department of Health and Mental Hygiene, but is a leader of public health more broadly than that. He's a physician, he's a public servant. He works at the intersection of culture and community in powerful ways that show us how we can build health equity capacity in all of the work that we do. He's a phenomenal leader, and we're excited to have him. This is going to work. Jeff is going to set it up for us, laying out some of the issues. Julian will respond. And then we've already gotten some great and exciting questions from you, the audience, that I know they're going to be excited to dig into. So thanks, Jeff. Thanks, Julian, so much for your time. Welcome, and over to you, Dr. Shaman.
Thank you, Mitch. Thanks so much for the introduction, the kind words. Julian, it's a pleasure to be here with you. And a pleasure to be talking with all of you here today. I'm going to start this off by actually using some slides. I'm going to share my screen now, and I'm going to go a little bit through some of the basics of climate health, global warming, and some of the impacts that are expected because of changing climate conditions on our planet. So give me one moment here to grab the right slide deck and actually make sure it's on the first slide there. Right. So this should be there in front of you, and let me just put it into full screen mode. All right. So Julian, give me a thumbs up if you can see that. Thank you. All right. So I'm going to be talking about the impact of changing climate on human health, and I'm going to start historically. If you read through what's here, this is from Thucydides' History of the Peloponnesian War. If you make it to book 7, he talks about the destruction of the Athenian expedition at Syracuse in 413 BC. And this was written just less than a decade later. And he says, after a particularly devastating battle, the Athenian generals consulted upon the disaster which had happened, and upon the general weakness of the army. They saw themselves unsuccessful in their enterprises, and the soldiers disgusted with their stay, disease being rife among them owing to its being the sickly season of the year, and to the marshy and unhealthy nature of the spot in which they were encamped. And in that last phrase there, that last clause, beginning with disease being rife among them, that is the oldest reference I've ever come across to malaria. This is long before germ theory, long before the mosquito was known to be the vector of malaria. There was a recognition that in certain times of the year, sickly season of the year, and in certain locations, marshy and unhealthy spots, people were prone to get a certain type of illness. In this case, it was the ague or malaria, and it was devastating this army in their stay because they had actually encamped in the swamps on Sicily. If we go ahead a little farther, that's a shot of the Roman bath in Bath, England. This is when the Roman Empire extended into the southern parts of England. Let me see if I can just get something out of the way here without making too much mess. Yes, good. What you see here is is an explanation, if you will, of not an explanation, but it's a rundown of some of the rich language that we have in English to describe things that are healthy or not so healthy. Words like pestilence and reeking and noxious and putrid and stagnant versus salubrious and fragrant and fresh. There was a recognition that goes back very long times that there were certain environments where the air and water were better for you and it was more healthful. If you go up into like the 17th and 18th centuries in Europe, there was a whole field of medical geography, which was set about to categorize what were the places that were helpful for people who were suffering from consumption, tuberculosis, and where could they be sent where they could actually be benefited by the fact that the water and the air was better. And this is an attempt to systematize the fact that there's a linkage between the environment and the climate and human health outcomes. Again, at a time before germ theory, before a real understanding, there is this attempt to systemization. Oops. If we go up to the present, this is from the Lung Institute right now, we see something that's actually really the same, if you will. And what it shows is what are the best and worst places to live with chronic obstructive pulmonary disease, right? And you can see that some of it is related to what is going on with access to hospitals and care, but there's a portion of it in what they'd use to actually make these recommendations that's related to pollution and related to other forms of air quality. So we have a general sense that there's this linkage between the environment and health and between climate and health. And certainly what's going on right now is that there's a concern because there's a lot of climate variability, and specifically there's climate change manifest as global warming and acceleration and intensification of the hydrologic cycle and other attendant effects. And as these conditions change, what is the impact of that going to be on human health? So before we go into some of the impacts, let's just go over the basics of what we're seeing, at least observationally, with the warming of the planet. So what I'm showing you right here is a projection of the entire surface of the planet, and it's gridded. You'll see how it's pixelated in these little rectangles there, which is showing us the temperature departure during the year 2024 from a 30-year base period that they've established as reference. So what they've done is they've taken the temperatures at each of those squares you see there, and they've averaged it for the year of 2024 at the surface. They've then done the same thing for a 30-year period from 1991 to 2020. They've subtracted that 30-year period from the 2024 average, and they're showing you the difference. And if you look at the scale on the bottom, it has pluses and minuses. The pluses are in red and the minuses are in blue. If 2024 was warmer than what we saw in a given location for the 30-year period from 1991 to 2020, those pixels are going to be red, and if it was colder, they're going to be blue. And what you can see is something that we've seen consistently over the last 30 years, that when you reference it to a recent base period of the preceding 30-year average, the year in question, the more recent year in question, is warmer for most of the planet. You can see a couple features of it. You can see that the warming is more intense over the northern polar region. You can see the warming is generally more intense over land masses, but you can see that it's actually pretty broad over much of the planet. The majority of the area saw surface temperatures that were warmer than that base period from 1991 to 2020. We can look at this a different way, perhaps in a way that you're more accustomed to seeing it, which is as a time series average for the whole global surface. So this takes that record that you saw there, which was just an anomaly, and for each year, it gives you the anomaly relative to a base period, which in this case is 1850 to 1900. So this is a period really of the instrumental record, and it's been reconstructed all the way back to 1850 when there was much more limited instrumentation, but they make estimates of it, and there are different centers. You can see NASA did it. One is the Hadley University of East Anglia Center, another is from the National Oceanic and Atmospheric Administration, et cetera. And these are their estimates. And as we get back to 1850 to the 1900 period, because the instrumentation is more sparse, you can see some disagreement between those estimates from the different centers. But the lines converge as we move forward in time, and the instrumental record improves because of much greater coverage for the surface temperature. And of course, what you see is that the temperatures have risen. The average is 0 for that base period by definition, 1850 to 1900. And then particularly once you get past the 70s, you see that it's been going up and increasing even in the speed, and it's at above 1.5 degrees Celsius warming at this point. Another look at it, showing you the uncertainty in that estimate of what the global temperature is for each year, shows it right here. And it shows something that may be a little bit alarming that you've heard about. You see earlier years on the left, which shows warmings of 1.1 degrees or less relative to that 1850 to 1900 period. And then there's a cluster from 2015 to 2022, where the temperatures are separated from that a bit. And what had happened in 2015 was an El Nino event, which tends to ventilate the oceans and result in a jump in the global mean temperature as the planet warms. And you can see that they're all clustered around there. 2015 is a little bit above 1.2, 2016 is above 1.3, then 2017 was lower, and you can see it's going back and forth. But then 2023 took an almost unprecedented step. There was another El Nino that started in the middle of that year, and temperatures took off and were even more markedly above. You can see the separation between 2023 and 2024, which was even warmer, and that other cluster that you saw associated with the last El Nino that took place in the years that were after that, before another happened. So a lot of this, of course, is linked to the rise in greenhouse gases. We have changes in greenhouse gases in our atmosphere. There, carbon dioxide is the big one that's been changing, but methane and nitrous oxide, chlorofluorocarbons, hydrofluorocarbons, they all have greenhouse gas properties. What you're seeing here is actually an 800,000 year record. These are taken from ice cores, where they go to Greenland and Antarctica and they take a core deep down in the ice. They will go down a kilometer, sometimes 2 kilometers into the ice. And as they go back, they're getting to older and older snow deposits. And in those snow deposits are captured tiny bubbles of air that have the air from up to 800,000 years ago. And they can take that back to the lab and they can just simply measure what was the proportion of the atmosphere that was CO2. And what you can see is that for 800,000 years, through the ice ages, which what these cycles coordinate with, because the CO2 follows temperature changes and the temperature follows the CO2 changes, I should say. But for that 800,000 year period up to really the present, the CO2 concentration in the atmosphere has vacillated between about 180 and 300 parts per million until you get to the Industrial Revolution. And at that point, you can see that line going what looks like straight up, simply because it's such a short period of time relative to this 800,000 year scale. It just launches up, and it is to where it is today, above 420 parts per million. All right, so what are the consequences of this global warming? Well, in addition to warming, as I mentioned, there is an intensification of the hydrologic cycle. Changes in the amount of heat in the atmosphere and the ocean result in more intense storms, higher levels of humidity in the atmosphere, periods where you get extreme events, both with lots of rain and also with breaks from the rain as well. So this is just some of the images of some of the things that you can imagine might have a health impact. You see a storm in the upper left photo. You can see evidence of drought taking place in the upper right and the lower left photos as well. I mean, heat waves in the upper left and lower right, upper right and lower left. And on the lower right, you can see a drought picture there as well. Just to sort of break this down, when I like to think about what the effects are in health, I put them into 3 somewhat loose buckets. I think about the direct effects, which are those that are directly associated with the immediate conditions outside. Heat waves, the impact of extreme storms, sea level rise, those are direct effects. I think about indirect effects, those which are mediated as a byproduct of the warming and the change in the climate system or the actions taken, and also the effects on biological and even social systems that then affect disease. Those could be air quality, which has to do with the byproducts of fossil fuel combustion that changes our air quality. It's associated with all the use of fossil fuels. Wildfires, elevated pollen levels, shift in water, food, and vector-borne diseases, outcomes associated with chronic diseases and mental health. And the last bucket I like to think of are complex downstream effects. This has to do with migration and climate refugees, food insecurity, and conflict. So I'm going to give you just a few examples of each of these, and then I'm going to stop and turn this over to Julian to say some words as well. So an example here of a direct effect would be extreme weather conditions that we see from storms. It's difficult sometimes to attribute a storm as being due to climate change, but if we see more storms than usual, if we're hit by a cluster of storms at the level that we've never seen before, with the frequency and intensity that we haven't seen before, we can start to attribute that to the effects of climate change. Hurricane Sandy may be an example of that. It's not impossible or unusual for us to have, or unheard of, I said, for us to have hurricanes coming this way. We had 2 in 2 years in a row. One was 2011 and the other was 2012. Hurricane Irene in 2011 just missed New York City and went over New Jersey and into our watersheds. Hurricane Sandy in 2012 hit New York square on, and of course caused extensive damage. In the upper right, you can see the lights out in lower Manhattan when they had to cut the power. In the upper right, you see that. In the lower right, you see the ships brought from the harbors off of Staten Island onshore by the tidal surge that came in with the hurricane. And of course, this results in blunt force trauma, drownings, but there are a lot of associated effects that come afterwards that have to do with the quality of the healthcare that's able to deliver. The lights are out in lower Manhattan. There is no power in NYU Langone. There is no power in Bellevue. They had to walk people on dialysis down the stairs. They had to take people in the ICU and walk them down the stairs during this event because the power was out. There were no elevators. They could not supply the machinery. They had to be hand transported down and taken off. And of course, that's a liability for patient. Then there are the effects associated with what about the mold that builds up, the flooding that takes place and the drainage of that, and the quality of the air and the water in the subway systems as well, and the attendant effects associated with that. Another example of a direct effect is sea level rise. This is showing you South Florida on the upper left, as it is now on the left. And on to the right of that, it shows you how much of Florida would be underwater should sea level rise 5 meters or 10 meters. And I want to just say that within Antarctica, there's about 55 meters of sea level rise should that entire continent melt. All right. So there is an enormous sea level rise potential that exists between Greenland and Antarctica. Greenland's much smaller, but it represents 6 to 7 meters of sea level rise as well. So this idea of a 5 to 10 meter sea level rise is not something that's just fantastical. One of the problems you'll see already on the right for a place like southern Florida is that the substrate is limestone, which is a type of stone that's based off of old shells from marine life and such. It's very porous. And on high tide days, they already get flooding there, and the flooding comes up through the limestone onto the streets. So it's not like they can build a levee or a seawall around Florida to actually prevent the sea from getting in. It's too porous a medium that they're on. The water is just going to bubble up and come from underneath. And then I just think it's important, if we're talking about sea level rise, to note that what's happening to South Florida is one thing. What's happening to some of the island nations in the Pacific, which have very low elevation, is much more existential. This is the island nation of Kiribati you can see here. You can see how right on top of sea level their infrastructure is right there. It's 1 to 2 feet above sea level, this entire nation there. So for them, sea level rise is an existential threat. It will result in a completely displaced nation state that has no place to go, if you will. And that's going to be very difficult to deal with because we're going to see this from quite a number of nation states in the coming decades, unfortunately. Indirect effects. Just to go briefly, this would be something like asthma and respiratory diseases. We're seeing longer warming seasons and altered weather patterns associated with global change, climate change. This increases in ground level ozone and air pollution, as well as earlier and longer pollen seasons. Changes in pollen levels since pre-industrial levels have been precipitous. In 2020, it was already 131% more pollen. In 2050, they're expecting 320% more pollen. Obviously, that has enormous implications for rhinitis, allergies, and asthma. The wildfires are another indirect effect. You get these rainfall events that cause blooms in the desert, as it happened a year and a half ago in California, and then it doesn't rain at all, and it dries out, and everything becomes tinder for a wildfire should you have a lightning strike or a careless campground or what have you. We've seen a lot of the news reports, of course. California fires over the last couple of years. The LA fires just a month ago were incredibly devastating. You can see the loss of homes here, and these are, of course, images from those most recent LA fires as well. Those are associated not only with people dying from smoke inhalation, suffering from smoke inhalation, but they elevate the amount of particulate matter in the atmosphere generally. If you have friends in LA, I'm sure you've heard about the air quality and how it changed, how the sky looked different, how it hurt to breathe. Wildfires contain inorganic gases, hydrocarbons, oxygenated organics. Those can lead to all sorts of problems that are systemic. Their very fine matter gets deep within the lungs. The finest goes into the alveolar sacs and gets into the blood system. There's pulmonary inflammation, systemic inflammation, oxidative stress, and immune dysregulation associated with it. And studies have shown that there are significant transient increases in all-cause mortality, cardiovascular mortality, and respiratory mortality associated with wildfire events. Now, the last one is the complex downstream effects. And these are ones for which, in my mind, climate change is just one issue associated with many, okay? Geopolitical issues, other stressors, economic stressors, they all can come to bear. What you're looking at here is a shot of Lake Chad in 1973. This is a very shallow transboundary lake that was large but not very deep and straddled 5 countries in Central Africa. And in 2017, you can see how much of it has been reduced in size. There's been climate variability and change that started to result in the loss of water in this area. As the lake subsided and drained out, the fishing resources died off, and the local people had to turn to agriculture. Where would they get their water? Well, they siphoned it off the lake, which further accelerated the drying down of the lake. Add to the fact that you have a lot of ethnic, colonial, and tribal conflicts within the region, different languages, customs, people, and religions. And this has been a place where conflict has been seeding and flaring up because of this. And it's not the only lake where we've seen this kind of event and circumstances unfold. Last one I'll just say, and then I'm going to stop, is food security. This is another big one that's disrupted by changes in temperature and precipitation and extremes. Human civilization is really based on our ability to produce food through agriculture and animal husbandry. Agriculture in particular, and agriculture is a bet that there's going to be certain conditions that are at least sufficiently reliable that you're going to be able to grow certain crops. And as the climate system changes, that reliable type of delivery of precipitation, levels of water, levels of temperature so that you can grow the crops that you've been able to is shifting. This leads to challenges, which leads to food shortages, food insecurity, migration, and ultimately also conflict at times. All right. We can look at it also as a threat and an opportunity, and I don't want to be wholly dire. I think there has to be consideration that there is agency that we, the people, have to actually do something about this, and we have to look for the opportunities that we have within this in moving forward. So that's a brief rundown. I'm going to stop my share, and I'm going to turn it over for a little bit to Julian to say some things. Julian.
Thank you so much for that, Jeff. I think that was such a great, clear and sober, explanation and layout of what we're up against, what we're facing. And as a clinician, by training, I'm an internal medicine doctor. And I really use this kind of generalist training, this scope of, taking care of an entire person, through their, adult lifehood. When I as someone who kind of comes from that world and has transitioned into public health, as a result, out of the necessity of responding to the COVID-19 pandemic, climate change is definitely on the radar. And as I hear these presentations and I give these presentations and I talk about, the risk that climate change poses to human health, I think that last bit that you shared is so important, that this actually does represent an opportunity. When we look at what happened with COVID-19, for example, for the last 4 years, last 5 years, yes, there was a lot of destruction. Yes, it was a disaster, but we saw what was possible from the worst of it. But I think that we also saw real evidence of what is possible for the best of us, as humanity, but also of our fields, coming from public health and medicine, to see how people showed up and answered and responded to that very urgent call. But, when I think about that response, I'm reminded and I feel, more confident and assured of what we can do and respond and how we can respond to climate change because of who we are, because of our roots, because of the training. And so, what I want to talk about for the next few minutes is, how we can look at these issues that we're facing, again, and tap into the basics, return to the basics, who we are, what we bring to the table, but also how we can think about a pathway forward because we must think about that. Despite all of the distractions and all of the things that may that elicit fear, we're in a point where I don't think that we can afford, we cannot afford to be mesmerized by the fear anymore. We're at a point where it's a time for action. And so events like this and the work that we're all doing is really important. And, despite all of the political things that are going on, we have a mission. And I think we're being called to respond to climate change as a public health issue. But this isn't new for us. When we think about the roots of public health, public health has roots in the social reform, right? People in the ancient world up until kind of more modern Western understandings of public health, people have always been looking at reforming the social structures, understanding that some people are more vulnerable, if they're near wastewater, and how we got to the aqueducts and how we organize ourselves as cities and how we can really understand that there must be this separation. Sanitation has come out of public health. Public health also has these roots as, we are these disease detectors. I think back to London, in the 1800s, in the cholera outbreak, and really finding out what is the source of this. We didn't have as many of the fancy tools that we have right now in modernity, but at its root, this is what we do. We respond to these things. But also, public health is also in its root, at its foundation, of an area for community care. When I think about my own personal and family roots in public health, we come from a line of healers. A lot of folks in my family on both sides, my American side and my Central American side, people take care of people. Communities have shown up and taken care of people and responded to the needs of the community. And even I think to my maternal great grandmother, she herself, she was a doula, before there was a formal name for doulas. She was a midwife in her small town in rural Central America, and she was delivering babies. And for my grandmother to tell me about our connection to public health, we have these deep roots, and we really need to tap into that and think about our role as, social reformers, as these disease detectives, but also the fuller breadth of what public health looks like and has been, in the United States, but also around the world. Public health, we do hard things. These issues that we're trying to solve are not the most simple, and that's why it's taken this multidisciplinary community, this approach, this discipline to come at these problems. We often think about health through the lens of healthcare, and there is a role and a place for physicians and folks with this clinical training. We have a role in it, but understanding the social determinants of health and looking beyond just clinical practice, in the medical care, we understand that the place is not as big as many of us may have been trained to see, or that we may think is a bit humbling, but it's also this opportunity to really understand all of the various factors that are contributing to the health and impacting the health of the communities. To the positive, when we think about access to many of these social determinants of health, but also to the negative, when people are denied or face barriers to achieving these social determinants. The great thing about having this framework for the social determinants, it easily translates to these climate determinants of health. When we look at the built environment, when we look at education, we look at medical access, we look at behaviors, and the built and natural environment, we think about and we have a fluidity in that language and understanding because of the work of the last few years, understanding and unpacking the social determinants of health. That directly translates to the climate determinants of health. When we look at the built environment, as you were mentioning, the vulnerabilities of our built environment, but also understanding when folks are living in housing that may not be resilient or wasn't built to withstand the new weather patterns, the new climate patterns in a region. We understand how some folks can be more vulnerable. Looking at access to education, looking at access to food, resources, if the levees break, if the bridge washes out, folks may not have access to healthy food. And we think about communities that already have minimal access, you can understand how that tracks, and so on and so forth. But that's really helpful. These framings are extremely helpful for us to take on something that may be relatively new for us. Jeff, you have a lot of experience, and you come at this work, with a lot of experience. But for a lot of folks on the call, me and myself, and climate change may be a more new or recent thing that has caught their attention, right? But I really want to assure folks that as we are really trying to make sense of climate change and how it impacts our lives and how it impacts our practice, that we have a lot of the basic tools, and we have a lot of tools that are readily available. And when we look at the social determinants of health framing, that's one thing. We look at the climate determinants of health framing, that's another. But when we look at how big and complex and complicated climate change is, I think another framing that is vital, I think extremely necessary for us to move forward, is the framing of health equity, and just equity in that language of equity, to really be able to dive deeper into some of these concepts that, for various reasons, public health and medicine, we haven't really done that research. We kind of shied away. We kind of turned away from these understanding of some of these real social conditions. We really turned away from what racialization has done to people, what marginalization means beyond this concept of people being on the margins of our minds, but marginalization as a violent process. People are literally being pushed to the side, sometimes physically, but through various policies and other things, that folks cannot have the access to certain things, that can prolong their life, that they can lead a more healthy life. Health equity is a lens and a framework to really help us understand these complex issues such as race, racism, but also a way to understand and approach this issue of climate change, because we have to have that lens to understand the complexities and understand how climate change is playing out, on our populations as a whole, but on the very specific communities. And what does it mean to practice public health and medicine, in New York City, in the largest, most diverse linguistically, culturally, and ethnically city in the United States, but also the most diverse city in this world? What does it mean for us to be able to practice healthcare, public health in this changing world with this rich community, that we serve? The great thing about all of these framings and what we come from and what we bring to the table as public health practitioners, and clinicians, is that our dogma does change. It is sometimes necessarily so. And when we know better, when the evidence shows us things, we fall in line. That's the scientific process. And I think about myself in my clinical training, there was a time, back in the early noughts where, starting HIV treatment, we actually used to wait to start before the CD4 count was at a certain level, or folks did, because of various reasons. But that fell out of fashion when we understood intervening earlier can translate to better outcomes. Even something like aspirin. I remember in my early training days, everyone was on aspirin as a primary prevention for a cardiovascular disease. That's kind of fallen out of favor based on the evidence. And so when we look at the evidence, right now, at how racialization, marginalization impacts folks, but we also look at the evidence, that you laid out so beautifully, Jeff, about how climate itself, the changing environment, is a catalyst, not just for poor outcomes for human health, but it's a catalyst for inequities, and holding both and that, yes, everyone is impacted, but some folks are impacted, disproportionately. We have to do all of that. And then the last bit that I'll share, and that I think is a part of this discussion, is discernment. It's all about discernment. We're in this moment where we have to find new tools, new skills, find new folks in our communities, find any and every source of knowledge, find sophisticated ways of understanding and approaching problems, things that may transcend the way that we normally used to do things, right? But we're in this moment where it's all about how we can build these school skills, and looking out and really absorbing the things, looking to the sources that we may not have looked at before. We have a tendency to have a hierarchy of knowledge, to really understand that there are communities that are on the front lines, at the edge of what climate change can look like, in real time. When we look at these more, communities in the global South that are disproportionately impacted and are dealing with these changes, folks are adapting. Folks have ways to relate to nature in different ways, and folks have different tactics and techniques. And we're at a moment where we really have to, you know, have humble ourselves a bit and look for the other sources of information. And so as we get into this conversation, I'm really excited for to open up the conversation and to engage the folks in the audience, but also to really make sure that we can ground ourselves and think about what we do have, what assets we do have, what we do bring to the table, what are our strengths, so we can take the systematic approach and know how we ourselves can plug into this bigger mission that we're all a part of, which is, again, preparing and responding to this changing environment in a changing, and unsteady world. So thanks. I think we can transition to the chat.
So I thank you, Julian. Mitch, I think Julian and I are slotted to lead the discussion further on a few points, and we can take questions along the way. Julian, there's one that's been posed in the chat that maybe we should just start off with that to go with, and then we can go to a couple of points here. The one here is asked by George Dawson, says, for me, the predictability of climate change related events has to evolve to generative AI alert systems is the starter phase of the impending disaster. How can we import AI technologies? Sorry for the phone call. Give me 1 second.
How can we import AI technology into disaster alertness?
Right. So sorry about that. I'm not at my own office and I can't answer the phone, nor can I shut it down. So I think this is a great question. There's a lot of work that's being done with generative AI to see how it can be actually put into inform weather prediction, climate models, alert systems, etc. I think there are enormous opportunities for taking advantage of technological developments generally to better support how we deal with climate change. But ultimately, there's got to be a pairing with the humans that are there. If people don't adopt the technology, if they don't use the technology, then it's not going to be something that's actually going to actually provide benefit. That said, AI is already being used to produce better weather forecasts than had been done by the traditional mathematical models. These are sort of statistical models. They run a lot faster. They use pattern recognition to actually make weather predictions. And they actually allow us to build out the statistics of what the weather is, meaning the uncertainty about a weather forecast. And that could be like a hurricane landfall. Where is it going to land? And can we get more defined probabilities of where it's going to land, how intense it's going to be, and what its impact going to be? That's already happening on the back end. There's so many technologies that we use already in our day-to-day, like on our phones, that allow us to get alerts, that allow our phone to ring when there's an alert that's really important and such. And I think it's going to be a question for society about how we integrate that into what we're doing. And it's important that we make sure that that integration penetrates to all sectors of society equitably, as Julian was talking about before, so that it's not just hitting certain communities and others that are less inclined to use it. It's not language appropriate, given a place like New York City with so many different languages, et cetera. So this is the direction that we're going to be seeing things moving more and more. And I think during COVID, we saw some of that as we started to see rapid tests developed. We wanted to have them integrated into smartphones so it could alert public health officials. It didn't quite pan out to the level we wanted, but some of the initial steps were taken there. Julian, do you want to add?
Yeah, what I'll add is I feel like we're in a similar place to where we were back in the 90s, where, people are on the news and it was like, what's the internet? And just to see how far we've come with the internet when we think about AI, and there is a promise there. But I think, there is in the chat, I think acknowledging that AI, we also have to understand how the internet itself had this dark side and some of the drawbacks. And so it's really weighing the benefits and what benefits we all, as as a species, as humanity, can reap
Mhm.
from it, but also weighing that against some of the risks, because AI is a massive energy suck. In a world where water is becoming ever more scarce, it is a big drain on the water supply. So there's ways, I feel like we have to temper it. I think that we must understand it. I think that
Mhm.
underrepresented communities that are not routinely represented have to engage and know what's going on, so that we are part of this, and that we can influence it, and reap the benefits. But I think we also have to all be wary of what AI can do, because it's not all, 100%. It's not all benefit, and we can't turn our eyes away
Mhm.
from the environmental impacts, as we have done for other technologies. Thinking about, cars, for example.
Yeah, and I would say so. So Faith Agnes has sort of keyed you off there because she said, "Is it not also contributing to climate change?" And the answer is absolutely. All our activities are using energy that is predominantly produced through fossil fuels. Still, obviously, with hydropower, we have a growing solar sector and a growing wind sector. Solar energy is cheaper than
Hmm.
burning coal at this point, but yet still we have not transitioned to have the levels that we really need to get off it. And absolutely, AI is resulting in need for massive computational power, which is an enormous energy source, which is actually using a lot of fossil fuels. And it leads to some real questions. There are other questions about AI as well as to whether or not it's a good thing and a bad thing. And these are important social and political questions that we have to address as a society. And I would actually counter a little bit, Julian. It's not just the community, but it's the political process here that's going to be
Hmm.
very important to
Absolutely.
engage and make sure that this is an important issue. One could imagine a future where AI is well developed and benign and useful, and in which we're using renewable energies for 99.9% of what we do. And in which case, its cost to us would not be detrimental and it would not be changing the planet. But unfortunately, we're a very long way from that right now.
Mhm. I agree. And I think one of the things that I want to bring to the conversation when we talk about technology, the promise of technology is a thing in modernity, where, like, yes, technology can change the world. I don't know if technology will save us, I don't know if technology is going to do it all. I think there is this human element, and yes, we are an advanced society, but when we look at how we value one of our most precious resources, which is other human beings, things we're kind of medieval in a way still, and with how we
Mhm.
treat people, how we value people, and how we and how we appreciate the human experience and what people bring to the table. I think that we as we try to develop AI, we shouldn't, like, focus all of our energy and develop this artificial intelligence, when our own human to human intelligence, it may take a hit. And we see evidence in, social media and other things, technology, as ways that actually kind of introduce new issues, new public health issues.
Mhm. So why don't I bring up another question, Julian, that was asked here, which is what can we do as public health practitioners to prevent climate change from worsening, in addition to mitigating health impacts that we are already poised to do? Do you want to take a crack at
Yeah.
that one first?
I can start. I think, we have a precedence. Public health, we recognize and realize certain social or external factors that may be negatively influencing health. And, we legislate, we advocate for change. We saw how there was a time where a lot of people were dying from car crashes, and public health got seatbelts in cars.
Mhm.
Public health really we were able to recognize and eradicate all of these now vaccine preventable diseases. And so, when we look at this climate change issue, there's, like, the day to day. What is our practice? How are we using our resources in public health? But there's the advocacy piece that we cannot forget. How can we throw our weight behind and add our voices to this broader movement to drive political change, social change that leads to those societal changes that we need to actually really counter climate change? The great thing is that people are primed and interested. We see where people's thoughts are, beliefs are in climate change. Increasingly, year by year, more and more people are concerned and recognize it as an issue on poll after poll. How can we in public health lean into that and throw our weight? Because there is this respect. The last few years in COVID, people understood the role of public health, and now is the time for us to really lean into and keep keep applying the pressure. I think that we're kind of past that time where in public health, we used to think, oh, when public health works, you don't know that we're there. I think we're at a time where we have to like let go of that particular romance and like we're here, we're advocating for this. This is what we know. This is who we are. This is what we bring to the table. We've done this before. We bring something new to the table. I think it's us taking on this public and civic engagement and really taking it on and being the champions for climate change, for political and social change.
And I think I totally agree. I think it's an imperative because both public health and climate change are unfortunately under assault with the current administration and the federal government. And that does mean real cuts in the kinds of funding that we can have here. I would also add that just to, getting back to the question of what can we do as public health practitioners to prevent climate change, we've been very reactive about climate change. And I'm not just talking about the US, I'm not talking about New York, I'm saying globally. We're very reactive and we're behind the eight ball. We really I wish that we could have seen the scientific evidence, not gotten bogged down into political political arguments that are trumped up from the same kind of engines that produced all the debates about whether cigarette smoke was bad. The exact same actors were employed to actually cast doubt on whether there's validity to climate change. We've gone past that, but climate change always has a problem in that it's never been the top priority. Public health has this problem also, which is why the kind of advocacy about we are here and this is what we do. This is why you have clean water. This is why your communities are safeguarded. What you were talking about, Julian, and being able to actually get that out there so people have a continued understanding. They're reminded of how important it is to have good public health infrastructure in place and that we improve and study our public health practices so that we can optimize them better and make them more efficient and actually get them so that they help more people in our communities broadly. The same thing has to happen with climate change, that people have to realize its threat. The problem is that it's a creeping threat. And we could probably go through our lives without, you and I, Julian, I'm pegging you for an age, unfortunately, right now, without feeling the adverse effects that our children will. And our children will not feel the adverse effects that our children's children will if we do not do something better about it. Because the effects are accumulating, they're accelerating. And 30 years ago, a lot of people could dismiss it as saying it's not happening. Now fewer can because they're looking at the wildfires and the storms and the fact that a 100-year flood is happening every 10 years, not every 100 years. And they're saying something is shifting here. And unfortunately, that's going to be even more evident in another 20 years or so. And we don't want to wait for that. We want to be able to proactively do something about that. So when you ask what can public health practitioners do, certainly they can be a voice of advocacy about it. Certainly they can highlight when climate change events are impacting them. Certainly we can think about hardening emergency services and responses for people. And certainly we can think about what we do in our own shop and how we can cut fossil fuel consumption, the same problems we were talking about with AI and all the generation. The healthcare industry produces like 10% of the fossil fuel output of the entire world. We need to actually think about what we can do to green these industries and make them better. And it's an overwhelming problem. This is something where people kind of get into this cognitive dissonance where they can't even act on anything because the problem seems so enormous and abstract, and you're one person who lives in one little corner of the world. But you have to break it down and you have to say, all right, well, I'm going to do this component of it. And I'm going to advocate that my work institution does this. And we're going to work together with the C40 groups to make sure that the practices that they have that are really good, we bring here, and anything that we develop really well, we're going to communicate to other municipalities and their healthcare systems there. So we have to think about breaking it down in a systematic way so we don't get lost in how overwhelming the problem can be.
Yeah. And I think that's where we are. It's like not like, yes, it's a big problem. Yes, it's scary. Yes, it's so multidimensional, multifaceted. But again, those are the types of problems that we take on. And so how do we allow ourselves the grace to understand, wow, this is shocking, this is a lot, but at the same time, at some point, we have to take the next step, take that first step, and just figure out what direction we want to go, we need to go, but we got to pick a direction. And
Mhm.
it's just one of the things where we're at a point where It's just something we have to add on our to-do list, right? How and in what ways are we thinking about this? In what ways are we doing it? And some people can show up and have capacity, bandwidth, resources, and can do a lot. Some people don't. But for some people, maybe it is just talking about it. I see in the chat someone's asking, what can we do with a CBO? Part of it, as a CBO, some of it is just this education. We got to talk to each other. We got to talk about this thing in a way that we're not overwhelming them, right? Because it's not again, we're past the call out. It's crazy. It's so bad. Yes, but we're at a point now to call people in. And like this series and what we're trying to really cultivate is this calling in. Come in and let's talk about this. Let's figure out how we can address this big problem that's not going anywhere. How can we do it? And it's a bit of a perspective shift, but I think it's a necessary one because like fear is not going to be the thing that sustains us, right? It's collective action. It's hope for a better future. It's hope for, as us realizing we have a responsibility to hand something of a world that, the future generations can live on. And it's really just this, it's a moral, it's like deeper than just a sense of duty and trying to save people. Like this moral place that we really have to find for ourselves to keep us going despite what's happening, in the political game, because we still have everyday ways that we can make these actions. And the collective action is it can change so much. And I think that the individual, we're kind of think so individual on this, but like we can all really be a part of making something bigger and better and kind of moving towards this new world with new systems and new perspectives. We can shift. Dogma can and does shift.
So I'm going to ask another question, Julian.
Yeah.
This one starts off, thank you so much for your remarks, Dr. Watkins. So thank you. As a member of BioBus, a community-based organization, I'm wondering what strategies you can recommend to help uplift data generated regarding climate change or detected diseases by the community. A lot has changed, but I see research co-led with the community not being as accepted as it should be. Thank you.
I think that's a great question, and that's where we are right now. And I think that's where so much opportunity lies, and that's why we have a dedicated discussion later in the series about communication, because there are the formal channels in public health that we post on our website. We release things in peer-reviewed journals. We do these formal channels, but we should also understand equitable communication recognizes that we need to use various different approaches. So really understanding what the target is and who our target audience is and what is the best medium for them. Social media is a great tool. There's a lot of folks who are doing amazing social media education, presenting things in accessible ways, in a language that people can understand. They're presenting hard data. It's really presenting alternatives to the standard, because some folks may not feel accepted by the standard, may not feel that the standard's for them. They may be looking for other information presented in different ways. There can be in-person events. There can be ways to pepper it in. There can be ways to work with, collaborate in the community. It can look many different ways, but I think partly it's like not being limited to the kind of standard official way that this information is presented, and being creative and collaborating, I think, is the best approach right now. And we've seen the expansion of what it means to be, a public health communicator, to be a community advocate and do these things in different ways. And we see that people have big followings and are actually really have stepped up and stepped in during the COVID pandemic, during MPOX. And I think even now people are really doing that work online and on these other platforms.
And I would just add, I can't add too much to that, but to say that I think it will take time. And I do think it will take time for people to start to really recognize the significance of the research that's done in collaboration with communities. More of that is happening, and I see more of it happening at my university, Columbia University. And I see a lot of it actually is published in great journals and coming along. I think there will be a perception that it's considered lesser science by some people, lesser scholarship. But in some sense, I would say put your head high, hold your head high, and just ignore that, because the people who are going to take it seriously are going to take it seriously because the content is there and it's saying something substantive that other people can then build off and use for further advancing scholarship and understanding. So I'm going to go to another question, Julian. This one says, what best practices should CBOs follow to support marginalized communities in climate preparedness, response, and recovery? Do you want to take a stab at that one first, or shall I?
You can go ahead.
Sure. So I think the most important thing here for preparedness is communication. And that's something where partnership with the appropriate organizations, be it a municipality, be it a public health organization, be it other community organizations, other CBOs, is going to be critical for understanding what are the preparedness techniques, what are the ways, what are the threats that are there, and what is my community at risk for? If I live in, coastal area on Queens, what does that mean compared to somebody who lives up in the upper Bronx? There are different kinds of climate threats. There are different problems associated. One may be more subject to flooding, and one may have a more chronic exposure to air pollution and combustion byproducts associated with the Cross Bronx Expressway. So there are differences in what communities should maybe be focusing on. And I think the communities themselves are the ones that are going to know, well, what are some of the impacts they see? But what you really want to be able to do is be able to put it together with, well, what are the changes here? What are the stressors that are going to be affecting this? And in that sense, I think, partnership and communication is critical. It's reaching out to community organizations, reaching out to municipality, reaching out to public health agencies and public health officials, reaching out to universities, doing the research yourself to understand it. I know that's a very general way of talking about it, but it's that empowerment through knowledge that's going to be critical for informing what you can do for preparedness. Response and recovery are a little different. Maybe, Julian, you can handle that, because that's more, what do you do once the circumstance strikes? What are the resources available? Do you want to take a crack at
Yeah, I mean, a colloquialism I'm from the South that people used to say all the time is, you got to stay ready so you don't got to get ready, right? And so part of it is in this preparedness bit, it's like, when I'm meeting with community groups, what is the stop, drop, and roll for climate change, right? What is the way that we can communicate effectively what to do in the sense, in the moment, or in the event rather, of this emergency that we've been prepared for. So it's talking about the fact that these things can happen. It's understanding that we have particular vulnerabilities based on where you are. People are doing that evidence. People are tracking it. People know where the flood zones are, right? People know what areas are vulnerable, in California, for example, to wildfires. And so it's really us doing that preparation and understanding, this is what we have prepared for. This is our escape route. Thinking through the things that often we don't want to think about the bad things because that will make us sad. But thinking, preparing for if the thing that may happen happens, how do we act, and how do we make it so that it doesn't, so that we're not so shocked that we may not be able to save ourselves or be active in the community or help folks. And so it's really just a preparedness and understanding that we have to have difficult, uncomfortable conversations about what could happen in this changing world so that we can, be better, so we can survive what may come.
So, Mitch, did you want to do an actual Q&A where people speak? I've been pulling the questions and they've been guiding our discussion thus far from the chat. Do you want people to raise hands and say something now?
Yeah, Bashar's been putting that in the chat. We would love that. We would love to see some hands raised. And I'll kick it off. So I'm sort of modeling this. We got some questions that came in beforehand from people. And one of those was about in how fast, in particular, arboviral and vector-borne diseases are expected to spread as a result of climate change. So in particular, is New York City going to see different amounts of those diseases in the future in ways we've been spared until now? What is that going to look like, and what do we need to do about it? And would love to see some hands being raised out there, and we're happy to highlight you once they go up.
Well, I've done a lot of work on arboviral diseases, including in New York. So why don't I take a jump at this one first? So, we were, of course, the epicenter of West Nile virus in 1999, and its emergence in New York City is when it first really got a foothold in North America. And it's spread since, and it's essentially endemic because it's maintained in the bird populations and to a lesser extent mammal populations within communities throughout the United States at this point. In addition, over the last 25 years, one of the principal vectors of dengue, chikungunya, and Zika virus has actually migrated northward under warming temperature changes and possibly some evolution of the species to be a little more cold tolerant, and is now steadily in New York City. It's captured in light traps every year, all over the city, all the time. It bites actually during the daytime. It's one of these biters that'll bite you in sort of afternoon if you're playing basketball in the park. And it's a vector. It's one of the principal vectors of those three diseases, which are real problems within more tropical areas. I think the concern for those kinds of vector-borne diseases, and I'll put aside Lyme disease for the moment, is that, we could see further shifts. We could see movements of additional vectors in. The other vector of, sorry about this, you just have to ignore it for a moment, but the other vector of these diseases actually is less cold tolerant and is not in our areas. So it's possible that over the coming decades, we could see that one move in. And that one's even slightly more efficient at transmitting these diseases. So these cause risks. We are a very multicultural city. We have people who travel into areas of the world continually where dengue, Zika, and chikungunya exist, and they bring them back all the time into JFK, essentially, coming off the plane. And even sometimes mosquitoes that are infectious could certainly walk off the plane and come here. We have yet to have a local outbreak of those diseases of any size that's been documented. Everything has really been imported to this point. And the concern is, well, will this happen? The big issue for me for this kind of thing is whether there's enough contact between mosquitoes and people that you're going to get a frequency of biting so that you can get that kind of transmission taking place, so that you could have an outbreak of, say, Zika somewhere in a community because somebody comes over, flies back from the Caribbean, they're infectious with Zika, the mosquitoes are here, they're bitten, and then those mosquitoes bite somebody else. To date, in the United States, it's been very limited. It's been limited even down in Houston, down in Florida, very limited outbreaks of locally acquired transmission of those diseases. That could break down ultimately, and I'm not going to say it's not a probability, but as long as we have these infrastructure that we have generally, not everywhere, where people are living in the quality of housing that you generally see in New York City, where their contact with mosquitoes is not huge, you're not going to see a resurgence of those diseases. And one of the things I like to say is that we even have the mosquitoes that transmit malaria here. And this used to be a malaria zone many, many years ago, but it's not anymore because we just don't have enough of those mosquitoes to cause the problems. And even in a place like Houston, which is by all rights a malaria zone, they don't get locally acquired malaria simply because they've drained their swamps. People live in air conditioner screened houses. They go in places in their cars and a number of other things that we have with the infrastructure there. So the concern is there, but it also would require a bit of a breakdown in some of the other infrastructure that we have here. That gets back to the whole public health messaging thing that Julian was talking about, the need for us to actually let people know that this is what your public health is doing for you. This is what we're monitoring. This is why we build some of the types of things we did. This is why we had housing laws in the 19th century put into place in New York City. It was a part of a public health revolution at the time. This is what has made us safe from these kinds of diseases. And even though there are more threats and there's climate change coming on, this is what we need to invest in order to keep ourselves safe.
All right, we have George Dawson.
Hello. So I'd like to take a stab at, and first of all, Dr. Shaman, I agree with everything you say regarding dengue and Zika and the like, and its migrations north. But considering Celine Sparrow's question about the Canadian fires in June of 2023, from a preparedness perspective, I think that just as we were caught shorthanded during the COVID pandemic with the respirators and all, ventilators, I think there may be an idea to float with stockpiling air purifiers for asthmatic kids. Just as they do in the summer, they allow free air conditioners for seniors without air conditioning. I think that stockpiling, say, an amount of air purifiers, at least on a test basis to see how that would work. I mean, you can't put them in a bubble, and even this year I was affected by the smoke we had in the city significantly.
Mhm.
And, and I'm over 70, and I mean, and I've been in California everywhere around fires, and this year really got me. So I think stockpiling air purifiers, that's one way to do it, in my mind, and to give them out to families with children with symptomatic asthma or severe asthma. Thank you.
Thanks. I can respond. We have a future discussion around emergency preparedness. We'll have some emergency preparedness specialists from around the city to talk about this topic in detail. But one thing that I will say about the fires of a couple years ago, and the air quality, this is a prime example of how climate change, under an awareness and understanding of climate change, will impact many practitioners. We understand the Bronx is a vulnerable neighborhood with large high proportions of young people experiencing and living with asthma. Understanding that on those days, where on the air quality days, having an eye to the air quality days, right, and sensitizing providers, but also patients, parents, families, etc., to have a keen eye for these air quality days, and really raising an awareness, and even just promoting and naming the air quality days on the news, and just having people more routinely, regularly looking for these things. That's one major thing that is active, that people are really promoting and trying to accomplish. There's also, as you said, ways that we can get folks necessary resources. I know a lot of providers are identifying purifiers, and ways to get purifiers through prescriptions, etc. But there's also there's various different programs that we can do, and also masking, making available masks, having families who have vulnerable kids stockpile masks and having them available. I think that's just something for like public health practice for the air quality days, but especially also for seasons like now, for cold and flu respiratory virus seasons, where there may be periods of high transmission, and some of our sensitivity, testing for some of these things may not be as sensitive because people aren't testing anymore. So there's kind of like the dual benefit from masking, especially for vulnerable kids.
So, Julie, do you want to ask your question?
Thank you so much. I hope you can hear me. Great. Dr. Watkins, Dr. Shaman, thank you so much for this. I have a question, your thoughts, please, on how we might mobilize and collect on the ground awareness of early signs and signals of potential health threats related to climate change. Does the city have experience in training and supporting kind of on the ground catters to document early signs and signals? Does the climate school have guidance on creating citizen scientist catters to do that kind of early surveillance and reporting on key signs and signals of potential health threats related to climate change? Thank you.
That's a great question. So, particularly considering climate change is a bit of a slow creep, as I said, that it moves along at a pace that's not necessarily as obvious as it might be otherwise. And the reason I say that is, if you think about the difference in temperature between the coldest temperature in a day at 6 in the morning and the warmest temperature at 4 in the afternoon, that's a much bigger temperature difference than the 1.5 degrees Celsius warming we're talking about over the last 150 years, right? In the same way, it's much warmer in July than it is in January. Those are much bigger differences, and it makes it hard to necessarily notice that individually. That said, what you're suggesting is something that I'm not aware of it being done in a coordinated public health climate approach. And Julian, if you're aware of this, please chime in. But the idea of putting together sort of a citizen core, it's what I think loosely goes on with CBOs, but to have it be comprehensive there, where, you'd ask people to feedback what's going on, are you having complaints about mold in your buildings? Now, normally that goes through normal channels and such, but is this related to increases in high intensity rainfalls that are causing floods in people's basements that are not as well documented? That would be a great thing to know how it's breaking down. I think it's a little more piecemeal. And if there are opportunities in the future to sort of systematize it in a way, maybe through this Preparedness and Response Institute that we have here. This would be a really great way of making it maybe a little bit more comprehensive and routinized so that it could be kept track of. What do you think, Julian?
I think that this is what public health does, right? We notice trends, we notice patterns. And so I think there's like the bigger patterns, and we have surveillance systems looking at emergency rooms as shared by Dr. Sparrow in the chat. We can see ER visits based on the air quality days, and we can understand this is related to these environmental changes. When we had the air quality event, it looked similar to that day in the summer. The ER visits were like similar to high pollen days, so there was more traffic, but the ERs were not like overly inundated. So that's important. But I think it's also like what we can do from a systems approach is for like clinics for sensitivity and awareness, right? If there is flooding in the region, for clinics and other healthcare facilities to kind of track the diagnoses codes, right? If we have an influx of people coming into our clinic with respiratory complaints, found to have mold, spores in their respiratory, in a respiratory culture, et cetera, those are ways that we can track and see and kind of connect those dots. So some in disease investigation, required, or investigation of like what's really going on, but that's required. But the you can't find what you're not looking for. So being able to recognize and look for some of these patterns is one thing. We also see it in some ERs during high heat days, and they check for traffic as well. So we do have some mechanisms. Are they as robust as they should be? No, but I think that's the challenge, and that's what the call is today for all of us have this sensitivity for like to just scan through some of the ICD codes of the people coming to your clinics, or kind of hear what our community groups complaining of. And if we're anecdotally hearing, people we're talking to are complaining, everyone they know is sick, and everyone after these days, like that's evidence that we can really use and to generate more questions or action.
All right, Mitch, what would you like us to do now? We're at an hour and a quarter. We can continue talking a little bit, or should we wrap up? What is your thinking here?
Let's take a second and see if there are any more questions that are out there. I love this discussion, and I want to note that after this, so just to frame the last few minutes, there are 3 more sessions in this series, right? And I think the vision, part of which is coming from the health department in conversation with you, Jeff, is for each one to have different panelists, some breakout groups, some sort of focused discussions about that. So I guess I would like to ask the participants, if you have questions or concerns that you want to make sure this series gets to, what do you want to go in conversation with? How do we make sure we hear your voices in powerful ways as part of this? So anybody out there want to step up and ask a question or name a priority that you want to make sure the series gets to over the course of its life? Okay, well, I think at that point, I'll just hand it over to you, Julian, and you, Jeff, to just say some parting words, and Bashar can close us out. I just want to say, I love this. I thought the grounding, Jeff, was great. Julian, I love the reflections on the importance of equity at this critical time and in this work. And I think there's some real mechanisms here. We should look for practical things that will come out of this series as a result of these conversations, for sure.
Fantastic. So I'd just like to say thank you to everyone. I want to note, Mitch, that some people are putting in the chat a few ideas for future discussion points on things such as community-based research, food security, opportunities for partnerships with groups building technologies in these areas. These are things that certainly we could bring into discussions going forward. It's been an absolute pleasure speaking with all of you. I think the thing that I would stress the most is the one at the end of my talk that Julian really took and ran with, which is that we can't fall into despair about this. This is really about what we can do practically and breaking down the problem and trying to move forward. We have to look at this as an opportunity, and an opportunity to make our society better, more prepared, more equitable, and actually capable of handling whatever slings and arrows the climate system throws at us. At the same time, trying to change some of the practices and policies that put us into this place in the first place and put us into this situation in the first place. So it's just a collective community effort, and please don't subscribe to despair about this. We have to actually be able to roll up our sleeves and try to do something about this. Julian.
Thank you for that. Yeah, I think appreciate this conversation, appreciate the engagement in the chat and folks who had great questions for us and really got have me. I'll be thinking and reflecting on some of these questions for a while. My parting words again, I think, is this message of hope, this message of duty, but also this message of curiosity. We're at a great time where anything is possible, clearly, for worse, but also for better. And we cannot allow ourselves to lose sight of that we can create this world that we are moving for, that we are working towards, that we've dreamed of, right? That we can create new pathways, that we can create new dogma, new strategy, make new connections, and create new opportunities for us to actually move beyond something new. Because I feel a lot of times that the old world is trembling and it is falling away. And we're at this moment where we actually get to build what is the next phase, where we are more integrated, where we are more intentional, and we are more imaginative in the ways that we can use all of our talents and skills and all of this community power towards this greater purpose. And I find no other purpose as noble, but as worthy a cause as us putting our energy and the best of us towards reversing and shifting away from fossil fuels and really reversing all of this climate disaster. So just thank you so much for your time and attention. Thank you again, Jeff. Thanks to the PRI team. Thanks to the DOH team and staff. Just really appreciate it, and just wishing everyone a lovely and safe weekend.